This is Cellulite Bundle, 2-in-1 Bundle, Cellulite Liposuction, written by Mary Abbott and Stephen Edmonds, read by Nick Dolle.
This is Cellulite, the ultimate guide to get rid of cellulite quickly, naturally, and forever. Written by Mary Abbott, read by Nick Dolle. Introduction. Cellulite is a skin condition that gives the appearance of small bumps and ripples under the skin. The bumps are caused by the underlying fat cells growing too large and stretching the natural fiber compartments that hold the skin to the underlying layers of tissue. Cellulite is ordinary fat, but ordinary fat that affects the appearance of the skin. Strand of fibrous collagen tissue connects the skin to the subcutaneous layers and also separate compartments that contain fat cells. When fat cells increase in size, these compartments bulge and produce a rippled appearance of the skin. Women tend to have cellulite more often than men because they have a vertical pattern of collagen in the underlying layer that holds the fat cells. And when the fat cells become very large, they bulge out of the chambers and appear as cellulite. In men, the pattern of collagen is tighter, in a diagonal pattern, and they have thicker skin, so there is less bulging of the individual fat cells. Another factor in cellulite is high levels of estrogen. Since this hormone has a direct effect on the holding capacity of the fat cells through the increase of alpha adrenal receptors, the chemical doorways that tell your fat cells to hold on to their contents. Poor diet, bad circulation, and poor lymphatic circulation can all contribute to the appearance of cellulite. Treating skin with cellulite. There are several extra steps you can take for the treatment of cellulite. Consider your skincare regimen and fine-tune it to meet the needs of skin that has a tendency to swell with fluids, store fat, and have poor circulation. Nutrition. Although cellulite is a skin condition, it's closely tied to the storage of excess fat. If you are significantly overweight, you should certainly alter your diet. The dietary enzyme bromelain can improve overall circulation to your skin and adipose tissues by removing the buildup of fibrin on the walls of blood vessels. Treating cellulite requires a two-pronged approach. One being the shrinking of the fat cells themselves, the second being the regeneration of collagen and strengthening of the skin outside of the swollen fat cells. Cleansing. When cleaning your skin, use your washcloth or loofah to massage the area where the cellulite occurs. At first, use a circular motion and then a brushing motion upwards towards the bowels. This will improve circulation and edema and help remove toxins and metabolic waste out of the tissues and interstitial spaces around the collagen and fat cells. Other treatments. Dry skin blushing. Learn to dry brush your skin.
Sample complete. Ready to continue?